Welcome back. Today we'll be addressing massage for golfer's elbow syndrome. Some people are a little bit confused about the exact location for massaging golfer's elbow. So what you're going to do is put your forearm, the affected arm, in the palm up position so you can have access to the flexor group, which runs from the medial epicondyle, the bony prominence on the medial elbow. It spreads out into a large group here, comes up, spreads out to a large group and comes down the forearm, runs into the fingers, crosses the wrist, and performs the function of the hand, the fingers, and the forearm, flexion of the elbow even. So what you want to do here is put a little bit of lotion on your forearm, and you can massage coming up. You always want to go upwards towards your heart. And I focus on massaging the muscle group in this area right here. Now you don't go so far underneath that you're irritating the ulnar nerve in front of the elbow or behind the elbow, okay? You don't want to be rubbing across that, but what you're doing is mainly this chunk of muscle right here, okay? And you can feel a separation. You'll feel a separation between your extensor group right here and then your flexor group. So by performing massage coming up towards the heart, I not only do it in a smooth, nice, controlled fashion, but I also like cross-fiber friction, where I'm taking the knuckles, digging into the tissue, but constantly sliding up the forearm as I'm going crisscross against the tissue grain, okay? So, and then up and towards the elbow joint into this region right here, okay? And again, as long as you're going back and forth like that, you can work your way back down. Just don't ever push the blood down towards your hand, okay? So really, if you don't even want to think about it, you can just go like this, work up the forearm, stop, start there again, work up the forearm, right here. And you want to work in between the divisions here, and this big thick group right here. Still all the same group, but it's just how it fans out, and then you have your ulnar deviators, so that do this on your wrist, and which can cause a lot of makes the joint sort of cockeyed, shifted, misaligned toward angles towards the tight side. So again, just massaging this area, and I wouldn't do it for any more than 5 or 6 minutes, because you can see that the area, you can see the blood developing in the area as the tissue gets warmed up. And really that's what your intent is to release the adhesions, the muscle spasm, the hypertonicity in the muscle group, because once this lengthens, it relaxes, okay? And then there's not so much pull on the medial epicondyle where the flexor group attaches, okay? So really what you're doing is relaxing these muscles to ease and relieve the tension where the micro tears have occurred at the medial epicondyle. You can do them 3 to 4 days a week, a couple times a day. Just don't overdo it. It's better to underdo it and be safe and smart, and not be, the area is already irritated, as in the medial epicondyle in this area, it's already irritated, so don't work on it and irritate it more. Work on releasing the hypertonicity, the tightness in the actual giant muscle group here, which is spasmed and just, overused for so many years. It's way more developed in the extensor group, so it contracts and stays in a semi-contracted state, therefore putting tension on the injured medial epicondyle fibers, okay? And then by releasing that tension, you're allowing a normal pull on that group, and then you're allowing it to heal. So again, perform that particular massage. You can also do trigger point therapy, where you're pushing on tender spots around the flexor group area. But when you are done, again, just finish with several strokes coming back up towards the heart to make sure that the blood is being pushed towards the heart. So I hope that helps clear up some of the issues with massage for golfer's elbow syndrome. Thank you. The flexor group, which flexes the wrist and the fingers and flexes the elbow, a small amount of flexion of the elbow, attaches to the medial epicondyle right here, okay? And what it does is that it fans out to this larger group of muscle right here, into this large section of muscle. This is where the belly of the muscle is. So if I go like that, right here, you can see that this is the muscle bellies of the flexor muscles and ulnar deviators of the wrist. Okay, there's a big group right there. Then it fans out. The muscles run into the tendons into the hands. Okay, so the area of massage is the area where the bulk of the muscle is. What we want to do is relieve the nodules, adhesions, and hypertonicity in the muscle in this area, because when you release it and allow it to lengthen, so it's not in a semi-contracted or hypertonic state, what it does is relieve the pulling that's always occurring on the medial elbows, like when you grip things or flex the wrist against resistance or anything like that, and there's any type of forceful wrist flexion, finger flexion, or even hyperextension, oftentimes resisted hyperextension, is that it will actually pull on the medial epicondyle, and then it pulls where the micro tears have already occurred. And this is what you're trying to treat. You don't want to irritate this area. So you want to stick to your massage through this area here. Generally, you're going to go towards the heart. You're going to massage towards the heart. This is running along the length of the muscles. They're running like this downward. You're going to run up the muscle belly, through the thickness of the muscle, and using a little bit of lotion will make it much more comfortable and softer, so it's not pulling your hair, especially for males. And so you want to do this and go ahead and warm it up for a minute or so. And there's a section here where it divides the extensor group between the flexor group. It's here, extensor group right here. You want to work from this area, making sure, again, you're not going too far down underneath the elbow here where the ulnar nerve comes into play, and then it goes into the elbow joint, and then above the elbow joint, there again, the ulnar nerve is in a location where it can be pressed upon and irritated. You do not want to irritate this area. The area already has issues. So you want to focus your massage here. So again, you're doing that longitudinal massage from the length of the muscles. Taking your knuckles, working the belly, going across the muscles, but still working your way up towards the crook of the elbow. You don't want to push down in the crook of the joint by any means. You want to stop right below it, okay? So you're massaging through here. You can find these areas that are like thick and very, very tight. You want to massage that along the inside here. And again, you're going across. And as long as you're pushing down, kind of lifting up, pushing down, lifting up, pushing down, like this, and going across the tissue. Now you're going crosswise across the tissue. Generally, you still kind of like want to go, you still want to go from low towards the heart. So that way you're pushing the blood that direction. But as long as you're lifting up, you can work back down as long as you're lifting your hand up, because that way you're not forcing blood downward into the vessels, which can cause them to expand and bulge in weakened sections of them, and you don't want that. So you can also try trigger point therapy, pressing on localized areas of that are sensitive, hypertonic, really tight, and that reflect referred pain. So I would just work in this area 5 to 6 minutes. Finish by, again, rubbing across it in a fashion, working again upward, and then finishing with massage, going again up the arm, pushing the blood towards your heart. Then once you're done performing the massage, you can perform the stretches, and then you can go ahead and perform your exercises for the full program. So I hope this helps you indicate the area, or locate the area that you actually need to be massaging is the muscle belly, this flexor group right here, in order to help lengthen it, relieve the tension that's on, of course, the hand, but mainly on the medial epicondyle. Thank you, and